This week, the number of new cases in Montreal has continued to increase in an exponential way. Yesterday, we had more than 3,668 new cases that were reported to public health, and we think it is underestimated, that this number is underestimated. Omicron is now representing more than 90% of all new cases. We have a positivity rate that is around 18 to 20%. So that means that 1% out of 5 that goes to a screening center is positive. We're seeing a new patterns for the groups that are more in the neighborhoods that are mostly affected. Of course, we still have a high number of cases for the 5 to 11 years old group age, but it's going to decrease in the next day. What we're seeing and the high increase that we have is in the group 18 to 44 years old. They represent now more than 60% of all new cases, and the neighborhoods that are mainly affected are Petite Patrie, Plateau Montréal, Myland, Villeray, Hochelaga, et Montréal Centre-Ville. We are seeing also an impact on our healthcare system with an increase in new hospitalization and intensive care unit admissions, but no increase in the number of deaths. Of course, right now, the groups that are affected are young adults, and our goal is really to make sure that we do not have this same increase in other group age, older group age, their parents, for example, and their grandparents. So as you may understand, public health doesn't have the capacity right now to do tracing for all cases. We're going to continue to do some tracing, but only for specific cases and outbreaks with vulnerable groups. So we're asking the population to collaborate with us. I'm going to try to explain simply what we're asking. If you have symptoms, a temperature, a fever, a cough, or a sore throat, we ask you to wear your mask, isolate yourself, and go get a test. It may be a rapid test or a test in a screening center. If one or the other is positive, and a rapid test is as valid as a PCR. So if you have a rapid test that is positive, you do not need to go in a CDD to get your confirmation. You isolate yourself for your 10 days, and you do isolate people that live in the same home or house as you. You won't get a call from public health. You may receive by email a questionnaire that you can fill out and send back to us so we can continue to monitor and understand how the transmission is going on. But what we're asking is that you call your close contact and ask them to isolate themselves for 10 days. And close contact are people for which you have been in contact indoor without a mask more than 15 minutes, 48 hours before your symptoms or before you had your positive test. That means if you had a party in a house, you went to a restaurant, a supper, you went for a beer, you had a ride in a car with a friend, those are close contacts. So those contacts are asked to be isolated for 10 days. If they have symptoms, they can get a test at a screening center. If they are asymptomatic, and we know that 25 to 40% of contacts are asymptomatics and may have COVID. So we do not have the capacity right now to have those asymptomatic person in CDD, but if you have access to a rapid test, you may do this test at the day 3, between the day 3 or 5 of your isolating period. So the people that we do not want to see in our screening center, of course, if you're just going there to make sure to validate your status before going to a party, and you shouldn't go to a party. Right now, that is not a good indication. If you're a contact of a contact, it is not indicated to get a test. If, of course, as I said, if you already had a rapid test that was positive and you're symptomatic, or if someone in your household is confirmed and you develop symptoms, it is not necessary to have a confirmation in a screening center. I just wanted to add that with the school closing, we have sent yesterday more than 2,000 letters to parents of children that were linked to an outbreak in a class. So we are asking those persons to isolate themselves for the period that is indicated in the letter. And we do not ask those persons to go get a test in a CDD. We prefer that you use your rapid tests that were given to you before the end of school. So to finish, I just want to say that if you're a case or a contact, really isolate yourself and do not go into contact with your parents, your grandparents, or people with chronic disease, pregnant women. We have to protect those population. If I think we all know someone that is now infected or isolated, I think we should all be calling those persons, asking them if their symptoms are progressing. People are going to be alone. Some of them are going to be alone during the holidays. So do not hesitate to call them, ask them if they need medicine or food, but be sure that they're okay. Of course, the third dose is really important. You may be offered Moderna in the next couple of weeks because we have more Moderna right now in our centers. We can switching those from Pfizer to Moderna is secure. It gives a protection against Omicron. Moderna is a good vaccine, and we do not see in literature that it has more side effects. And of course, when you know someone in the group age for their third dose, do not hesitate to call them, ask them if they need some help to get their appointment on Click Santé or to go with them at their appointment. We had yesterday the measures announced by the government for the holidays. I think in the Montreal situation, we should be putting those recommendations right now into application. Reduce your gatherings, reduce your contacts. See if you have to see parents, see them outdoor, do more activity outdoors. And of course, the smaller the gatherings, the better it is. So I just want to finish by saying I hope you take care of yourself, take care of the loved one, and thank you for your collaboration. We're all in this together. Thank you.